And welcome to our June meeting of the Massachusetts Board of Early Education and Care. And thank you so much to the Taunton office for hosting in this wonderfully spacious room with bright lights. It's nice to see everybody on a summer day. We have a strong agenda. Joanie Block will be joining us shortly. She's running a little late, but just want to also recognize publicly that we will be toasting Joanie in her tremendous service to the Board of Early Education and Care and to the Commonwealth just before break. So we'll do that little farther along in our agenda. For now, you can see our agenda really follows on the May meeting in lots of great ways, and want to thank the commissioner for her ongoing leadership. Second board meeting for the new commissioner, and looking forward to just more discussion, as you'll see, sort of well framed in terms of both program and educator support and then family access. So we'll continue to use the strategic plan as an organizing framework. Particularly of interest, I think, are these C3 findings from the April survey, which are very robust and informative and signal lots of things about the system and about a financing strategy. So with that, I'm going to turn it over to the secretary and then the commissioner.
Thank you, Madam Chair.
Sorry, I should have mentioned that Jamila Lee and David Cruz are joining us by phone. Thank you.
Thanks again. Just a couple of quick notes, but both budget related. One is the FY23 budget is in process. It's still in conference. Hopefully that will resolve itself shortly. As you all know, and we'll talk about this momentarily, the C3 grants are included in the Senate version of the budget, not in the House version, at $250 million. The governor had asked for $450 million. But in some form or fashion, we are certainly hoping the C3 grants will be extended into FY23, ideally all the way through the end of the fiscal year, but we'll see how the conference works itself out. Nonetheless, I obviously encourage anyone out there listening within the sound of my voice, if you know a legislator, you might want to give him or her a call and encourage them to be supportive. The other is the governor introduced a supplemental budget a few weeks ago, which included two items of particular importance to early education. The first is a $10 million innovation fund, which would be under the control of the Department of Early Education and Care, which would be designed to support innovation and change within the sector in developing and supporting the launch of new models, in particular those that are related to what is broadly being termed the future of work and the changing environment, not only for the child care system, but also for individual families, workers, and employers. And then the second is a $45 million down payment assistance fund, which would be built off an existing program that is run out of the mass housing, which is designed for low-income families, but this would be specifically extended to include family child care providers as preferred and prioritized recipients of this down payment assistance in order to create a new program, in order to expand and upgrade capacity, and overall in order to support obviously a critical part of the system that may be even more important to us going forward with all the changes that are going on in the workplace and in our sort of family lives post-COVID. So with that, let me turn it back over to you, Madam Chair.
Thank you. Seems very important initiatives at this time when I think about what we've learned from the C3 and its data, which we'll talk about today, but also a moment certainly to innovate and in particular to support our early educators. And I think especially given the fragility of the family child care system, particularly important. So thank you, Secretary and the administration. Commissioner.
Thank you, Madam Chair and Mr. Secretary. I want to just start by thanking the Taunton team for hosting us today. We're joined today by Regional Director Renee Collier, and her team, who's been very welcoming to all of us in this new space. And also just to recognize the staff of the department. I'm in my 9th week now, and they have been incredible in sharing their work with me and trying to bring me up to speed. Learning about all the good work that's happening in the agency and also moving some really important work forward that we're happy and looking forward to sharing with you today. I have a couple of updates on our COVID-related work. Since we last met, we issued updated guidance on quarantine and isolation in alignment with the Department of Public Health, Department of Elementary and Secondary Education that is consistent across settings, child care camps, and schools. And we worked really closely across the administration to get that quarantine and isolation guidance out. We've also made an announcement to all of our providers that we will continue to be providing tests to them in support of being able to keep kids consistently in programs and in alignment with that quarantine and isolation guidance, at least through the end of this calendar year and likely into 23 as well. We are working right now, good news for all of us, coming in the last week with the CDC approval of the vaccines for 6 months to 5 years of age. And we are working very closely with the Department of Public Health, and we'll be working with our child care providers to do outreach through the providers and to parents about the availability of vaccines and sharing information. And we'll also be working with the Department of Health around their vaccine equity initiative to make sure that we can make those vaccines available across the state as much as possible. Couple other updates for those of you who have been following for several years. Our child care subsidy system is really funded through two mechanisms. One is vouchers that go directly into the hands of families, and the other is through contracts to providers. And these contracts include for low-income working families through our income eligible program, and then priority populations for supportive or our families involved with DCF, teen parents, as well as our homeless families. These contracts are somewhat outdated and in need of reprocurement. And due to COVID and a number of other factors, we are not in a position to be able to reprocure those at this moment. So we have gotten approval from the Operational Services Division or the Comptroller's Office to extend those contracts on an interim basis to enable the agency to undertake a reprocurement process within the next 18 months for those subsidized contracts. And you'll hear a little bit more about that later, but I know many of our providers have been anxiously awaiting both the opportunity for reprocurement as some time has gone by, and we know things have changed demographically and in the needs of families. So we're looking forward to undertaking that work, but are grateful for the opportunity for interim contracts so that there is not a disruption to families or to the services while we do that work. Similarly, our child care resource and referral agencies, their contract is also up. And again, due to COVID, not a moment when the agency had time to really undertake a procurement. So we've been granted approval for a 12-month interim contract while we work again on that procurement. And you'll hear more about that over the next year. But we're grateful for the partnership and collaboration from the Operational Services Division, enabling us to put these interim contracts in place. Similarly, the board may be aware that we've been operating under a price limitation waiver over the past 2 years. The price limitation rule, I don't know if it's flickering. The price limitation rule is a state procurement or purchasing rule, which means private institutions who purchase services are not supposed to charge the state more than they charge a private vendor for the same service. Because of the instability in the early education and care field and the increase in rates over the past several years, in some cases, the public rates have exceeded the private rates. And because providers are trying whatever mechanisms they can to help support the financial needs of families seeking access to early education and care, we've been operating under a waiver which allows the providers to accept those rate increases without increasing the rate on private pay families. This has been very important for providers who are subsidizing perhaps their staff or seeking outside financial assistance to support families to enroll in early education and care. So we sought and were approved for a third year of that waiver, which will go into effect in July, which will again give the opportunity for us to maintain some level of stability in the field. So grateful again to the Operational Services Division for their support of our work in maintaining some level of stability in the field. So a little bit of in the weeds updates for you, but that's what we've been up to.
Great. Thank you, Commissioner. Welcome, Joanie.
I am so sorry.
Sometimes the closer you are to the meeting,
My house is 5 miles from here.
sometimes that happens.
I went to the old office. I didn't even.
Oh, the old
I'm a
Taunton.
teacher. I don't need directions. Right? So I
thank you,
apologize.
Joanie.
It's the first time I've ever been late. And I do apologize, everybody. You will get your candy.
Looks like you brought a lifetime
We'll take
supply.
a break.
Given, thanks for that.
All right, great. Well, we had one written public comment. I'm not sure that we have any public comment, but certainly invite that if there's any at this time. No public comment. We had one written comment about the location for fingerprinting, which I'll defer to the commissioner and her team on in due time. Our next item of business is the approval of the minutes from the May 10th, 2022 meeting in Boston. Any corrections, amendments, etc.? Okay, I'm going to call the vote, and we have Jamila and Dave online. I'll call you in just a moment, but I'll start in this room with Paul Belcedo. Oh, let me make the motion. I'm sorry, so sorry. Let me make the motion that we approve the minutes from May 10th, 2022 meeting of the Board of Early Education and Care. Could I have a second?
Second.
Thank you. Paul Belcedo.
Yes.
Secretary Pizer.
Yes.
Maura Siegel. Joanie Block. Thank you. David Cruz. And David, can you hear me?
Yes.
Thank you. Jamila Lee.
Yes.
Great, thank you. No, Carolyn wasn't here. Right? Am I right about that? Am I right about that or wrong about that? I'm right. Yeah, you're good at that. All right, thank you. Approved. Carolyn is always
Okay, we're off to a
she's always on top of the legal part for me. It's very helpful to me. All right. The next vote is for us to approve the board meeting dates for the fiscal year 2023. You have it in a document. It lays out a monthly meeting from September through June. There it is on a slide. Anything to flag before we vote on it? The schedule. Everybody good? Joanie, I know you're not concerned with next year.
But I need to be available to watch.
Okay. That's good. All
I'm
right,
not leaving.
Never. Once in the family. All right. Let me make the motion that we approve the board schedule meet. Oh, here, let me make the real motion. I move that the Board of Early Education and Care, in accordance with General Law, Chapter 15B, Section 3B, shall meet in accordance with the schedule set forth above, and that all meetings will begin at 1:00 p.m. and will be held at 50 Milk Street, Boston, Massachusetts, unless otherwise announced and duly posted. Could I have a second, please? Thank you. Carolyn Kane.
Yes.
Paul Belcedo. Secretary Pizer.
Yes.
Maura Siegel. Joanie Block.
Yes.
David Cruz. Jamila Lee. Thank you. All right, so moved and approved. Thank you. All right, we will launch in now to our items for discussion and action. We effectively have two, and with two parts to the first one, our C3 grant, and then a conversation about educator qualifications, credentialing, and minimum hiring requirements. We'll then move to family access before we take a break. A candy break from Joanie. All right, so we are going to start here at the C3 grant and the survey findings in particular, and I think Jocelyn and Adrian will lead this discussion. Yes. Thank you.
I'm just going to ground the discussion for the rest of the board meeting in the overall pillars from the strategic action plan. So as we talked about last time, just, the work of the agency and the organization's strategic action plan is really focused around our key users and systems, around our children and families, our educators, our programs, and the work we're doing to support underlying the system. Last month, I shared with you sort of the organizational strategy that we're using to operationalize the strategic action plan, really thinking about human-centered design, and thinking about the experience of our families, our programs, and educators as they engage with the agency and we support them in whatever endeavor it is, whether it's licensing, seeking a subsidy, seeking stable financing for the programs. So today we're going to spend some time first on the educators and our programs. And the C3 is sort of a unique one in the sense that it crosses all three. Even though the unit of support is the program, you'll see from the data that we're looking at that it touches broadly, both on the program's operations as well as our educators and into families. And I just want to note in this presentation that we, late breaking, we've added 3 slides to the deck that you saw. So we did collect information both on the operational experience of programs, on the impact on educators, salaries, and retention. And we also collected information on programs' experience with participating in the subsidy system. There are 3 additional slides in here that are hot off the press, and we didn't want you to miss. So apologies for the late breaking news, but on the document that we'll post and that we'll distribute to you afterwards, we'll include these updated slides. So I'm going to hand it over to Jocelyn Bound, who's our Deputy Commissioner for Program Innovation Support and Research, and Adrienne Murphy, in case you haven't met her, who's our Director of Research and Data Analytics. But first I want to mention that to date we have distributed to programs $380.3 million, including through the C3 program, including $14 million in a workforce bonus funds that went out during June to support one-time and ongoing support for our educators. And we have 6,726 programs participating in the C3 program, which is about 88% of the total number of programs as of June 2022. So we are reaching deeply into the early education sector, and I look forward to these 2 sharing the findings from our April survey. So Jocelyn, Adrienne.
Thank you very much, Commissioner, Chair on the board. We're very pleased to be here to share the findings from the April survey. I know we foreshadowed them a little bit at the last board meeting, and I'm happy to turn it over to Adrienne, who's been doing a lot of work in the
Great, thank you. Thanks, Jocelyn. So I'm excited to dig in a little bit. Before we dig deeply into the data, a few key takeaways from the data that we'll go through in the next few slides. First, on the grant spending front, so similar to what we saw in the fall survey, providers are continuing to spend the bulk and the majority of C3 funds on operational expenses. They are spending, however, a smaller proportion of funds in this past expense category, which includes COVID-related debt as well as past expenses, as well as in the sort of other operational expenses category, which I'll dig into. Should I? Is it audio?
Sorry.
Okay, no, totally. I just
See
don't know
if they can hear.
if I should.
Dave and
read-
Jamila, can you hear all right?
Yes, I can hear. Yes, I'm fine. Yes.
Okay, great.
thanks.
Wonderful. And a smaller proportion of expenses in this other operational expenses, which we'll dig into, but is mainly space and plant related expenses, rent, mortgage, utilities, insurance, etc. On the group and school age side, programs are increasingly using costs to address staffing, both current salary and benefits, as well as investments in educator salary and benefits. And on the family childcare side, providers are continuing to use these funds in service of operational stability, and we'll look into that breakdown. On the educator side, we saw in the survey that providers are still continuing to struggle to hire staff. Overall, 65% of group and school age programs reported having at least one educator opening, and 23% of all group and school age programs reported having educator openings that were preventing them from serving their full license capacity, which certainly has implications for the capacity of the system. And then last but not least, the commissioner mentioned the additional questions we asked in the survey around subsidy access, and we asked providers questions around their current participation in the subsidy system, as well as barriers to either expanding participation in the subsidy system for providers who are already accept subsidies, or for providers who are not currently participating in the subsidy system, barriers to entering the subsidy system. And we heard from that latter group barriers that included capacity being full with private pay families, reimbursement rates being too low, and administrative burden as being high. And I know a team later today is going to talk a little bit about the work of the agency in supporting family access. So there we go. Before we dig into the data itself, just a little bit of an overview of the survey. As I think you all know, this is the second of a series of surveys that we provide for C3 grant recipients to learn more about their use of grant funds, but also investments they're making in educators and services to families. This survey launched in mid-April. It launched on April 19th. And we were able to get a pretty high response rate because we require providers to complete the survey as they apply for their next month of grant funds. The data you'll see today is as of May 24th. We did a poll on May 24th where we had just under 5,700 providers, or 87% of all grant recipients. And that number has continued to tick up. We just passed 6,000, so providers are continuing to complete the survey each day. We had a slightly higher response rate among family child care programs, just at about 90%, slightly higher than group and school age programs at 81%. But again, folks are still continuing to respond to the survey.
Yeah, and I think on that, I'll just say we've noticed a pattern that family child care providers tend to recertify immediately, whereas group and school age tend to sort of gather their information and come in more periodically and applying for the grant. So that might account for the difference.
Yeah. Great. So I'll start by talking a little bit about what we learned in the survey around enrollment. As you likely already know, we collect enrollment data as part of the monthly grant applications. So we shared at the last board meeting, we've been tracking over time enrollment as a proportion of license capacity over time and have seen that increase throughout the grant period. But what's unique about the survey data that we collect is we're able to parse out full and part-time enrollment and get some additional insight into how enrollment is changing over time. So as here, this data on the slide is subsetted just on providers who responded to both the fall and spring surveys, so we get an apples to apples comparison over time. And this really mirrors what we've seen in the grant application data, that we've seen an increase in enrollment both in group and school age and family child care programs over the course of the grant. In fact, a 5% increase in enrollment overall, which amounts to just over a 2.5 child on average increase in enrollment in group and school age programs, and almost a 0.5 child on average increase in enrollment in a family child care program. And what's sort of unique, or the added insight here relative to the monthly grant applications, is we can see that this is being driven almost entirely by increases in full-time enrollment. In fact, the average group and school age program saw a 7% increase in enrollment, and FCC programs saw on average a 9% increase in full-time enrollment. And so it allows us to really dig in and see that these increases are being driven by children enrolling full-time in programs.
Adrienne, I just wanted to mention to the board that there is, in your appendix to the slide deck, is updated information that we presented last month about license capacity relative to pre-COVID and now too. So what we're seeing in that is definitely a continued rebound. We're not up to where we were in pre-COVID levels, but we are closing that gap. And our license capacity is different than our staffed capacity, but we are seeing that the overall sort of seats for kids are coming back to where we were pre-COVID, so which is meaningful in terms of how we think about supporting programs to really bring that staffed capacity up so that we can continue to see enrollment increases.
So the next few slides look at the spending data that we collected through the survey process. And as I mentioned at the outset, providers are continuing to spend the majority of C3 funding on operational expenses, which are sort of the blue-hued pieces of the pie at right. Overall, providers have spent 65%. Providers that responded to the survey report spending that 65% of grant funds, or about $149 million in these operational expense categories, the blue categories. And that includes $88 million on existing payroll and benefits, $11 million on COVID-related debt and other past expenses, and then almost $50 on the sort of other operational expenses category. Providers have spent about 20% in the sort of red-hued categories, which are sort of new expense categories. That amounts to about $47 million, including $38 million in educator salary and benefit increases, as well as one-time educator bonuses. And then an additional $9 million in professional development, mental health supports, new materials and supplies, all of which are captured in that other new investment category. And we'll dig a little more into these numbers. While providers across the board are spending primarily on operational expenses, the type of operational expenses vary by program type, with group and school age programs spending almost half of their grant funds on existing payroll and benefits, and family child care programs spending almost half in this other operational expenses category. And we'll dig into what that exactly that looks like, but it's largely rent, mortgage, facilities. It's sort of the expenses related to the operations or sort of physical plant of the child care program. And then now that we've administered this survey twice, we can also look at how this spending varies both over time and by provider type. And you can see here that both across group and school age programs and family child care programs, providers are spending a smaller proportion of funds in this past cost category. So this is COVID-related debt and the repayment of other past costs. And also a smaller proportion in this other operational expenses category, the mortgage, rent, facilities category. On the group and school age side, providers are spending more overall on educators. That includes both existing payroll and benefits, as well as educator investments and bonuses. And then on the family child care side, providers continue to spend the bulk in operational expenses, although slightly decreased from November, and also an increase in unspent funds. We did collect some information from providers about their plans to use unspent funds, and we also heard in the qualitative data of the survey from family child care providers who talked about saving for things like new heating, new roof, that some are saving for larger expenses.
I think I just want to jump in for a second
Yeah.
and say, as the team talked about some of these findings and recognizing the relationship between the first slide around enrollment, and as enrollment rebounds and more families are participating in programs either through subsidy or through private pay, you can see the funds shifting into new investments.
And then I'll wrap up this section just by sort of doing a little bit of a deeper dive into that 46% of funds that family child care providers are spending on average in other operational expenses, because it's sort of a bulk category where we've lumped a few things together. But you can see that the majority of this category, and in fact 30% on average, family child care providers are spending on average 30% on rent, mortgage, utilities, and insurance, with an additional 11% on facilities maintenance and improvement. So the bulk of this category really is on physical space-related expenses, with a small proportion, 3%, on COVID-related, both PPE and COVID-related sanitation, cleaning, et cetera, COVID-related expenses, and then a small other 2% in, that's the sort of other catch-all category.
And one reflection that we have been looking at, one thing we've been thinking a lot about with family child care providers is how do you sort of, in a commensurate way, consider the workforce investment in the same way we have been in the center-based.
And I think it's important to call out here that in a family child care, the home is the child care provider's home. And so the investments in the business are in fact an investment in the provider as well. And that there's such an integrated connection between the stability of the business, the quality of the home, and the provider's lifestyle and, sort of stability herself or himself.
Yeah, it seems exactly right at this point, right? Especially in this kind of stabilization, recovering debt and expenditures on the COVID, thinking about it outward over time, right? When we're in the quality improvement workforce kind of frame, it'll be interesting to just think that through. But I agree with the analysis.
I'm going to transition away from the spending categories. I want to make sure any other sort of questions before we move on. Great. And we'll,
Of all this data, did anybody surprise you?
I think for me, it was, echoing what the commissioner said, it was reassuring to see, we've seen enrollment increase. We sort of assume from that revenues are increasing. So to see the shifts in spending, that also seemed to reflect that there's a freedom to start moving from past expenses, for example, which is really a stabilization investment, into starting to look at how that money could be expended and invested in the business, was supportive of our hypothesis that we are, while not out of the crisis that the field has been in, certainly moving in the right direction.
So I don't know if you even asked this question, but since some of the funding went to salary and other supports, do you have any information on retention of staff?
That's a good
We don't. We asked about staff openings,
Yeah.
but not about retention of
I'm just
staff.
thinking about the issue of quality. We know
Mhm.
that that's linked, and if down the road, if we look at that, at the quality piece,
Mm-hmm.
I think the retention would be an interesting piece to look at.
Yeah, no, it's certainly essential for, bearing fruit from the investments that are going into the staff.
Doing one fire at a time.
Yeah.
I know.
But I think we're about to go to the
Yeah, I was
educator
gonna say
data,
that's
and I think it's fairly clear that they're struggling with staffing, and whether it's hiring from the initial or retaining staff. I think we didn't ask about that, but I think it's definitely present in the data.
I think that's a great segue into talking about some of the educator data that we collected as part of the survey. So we asked specifically programs whether they had spent grant money on increasing educator salaries or any other funding source. And across all funding sources, just over half, 51% of programs, that includes 85% of group and school age programs and 40% of family child care programs, reported investing in increased salaries. We asked on the group and school age side about the number of educators that were impacted by these investments, and you can see those numbers at right. We collect the total number of educators by provider, but not by role, so we can't break out the role numbers as a proportion of all educators in that role, but we do know overall that represents about 73% of the total group and school age educators reported in the survey. That were impacted in some way by a salary increase, whether from grant funds or from other funding sources.
And is there any, has there been any discussion from the programs themselves on sustaining those increases over time?
We didn't ask specifically about that. I'm just trying to think through all of the qualitative information that we read through, but we didn't ask specifically about sustaining or sort of their plan for sustaining those investments.
I mean, I think some of the concerns we've heard from programs reflected in the comments,
Yeah.
but also in conversations with programs is, understanding whether it's going to be an ongoing source and whether one-time funds should be put into salaries or one-time investments.
That's what I'm thinking about the short, medium, and long-term implications and plan will be. Yeah, thanks.
And we see, despite the salary increases, staffing challenges continue. Staffing challenges remain. We asked providers about whether or not they were able to serve their full license capacity, and 14% of all programs and 28% of group and school age programs said that they were unable to serve their full license capacity. And among group and school age programs, 23% of all group and school age programs that responded to the survey reported that they were unable to serve their full license capacity as a result of unfilled staff openings, which really speaks to the impact of continued hiring challenges on the capacity of the field.
So we don't have any, this is the first time we have this data set or any, for this and the 23, I was
Yeah.
curious of what the historical.
It's the 14% is down slightly from 19% in the previous survey. So the overall percentage of programs that are unable to serve their full license capacity is down from the fall. I don't have the we don't have, to my knowledge, we don't have pre-pandemic data, and I don't have the staff opening comparison point at my fingertips.
And it's not necessarily the exact same sample.
It's not. This is all providers who responded to the survey as of.
But the participants from November who was participating then?
Yeah.
And chose to complete the survey.
Right, they're one-time,
Yeah, I
they're
didn't-
one-time samples, right, Jocelyn? Like, okay.
Yeah. The enrollment data we showed was that sample was limited just to providers that responded in November and April.
Oh, okay.
But this is not subsetted just to providers who have responded at both periods of time.
But if you hold the two constant, then your 14% is sort of, it's a different denominator.
Yeah. Yeah. Yeah.
But this is reflecting what we heard about classrooms closing.
Yeah.
Yeah.
Yeah. In the next few slides, we'll look at some of the data around subsidies and around participation in the subsidy system. And so I want to sort of start out to frame out this conversation. Overall, 65% of providers who responded to the survey currently accept families with subsidies, which is higher than the number of that percentage for providers statewide. And then nearly all programs in the survey that accept children with subsidies served at least one child with receiving a subsidy at some point over the period we look at in the grant. So we'll dive into the 65% that currently accept families with subsidies, and then we'll also dive into the 35% that do not currently accept subsidies. We asked so looking at that 65% of providers that responded that currently accept families with subsidies, almost 3/4, 74% of group and school age programs and 72% of family child care programs, when we asked about barriers to expanding access to subsidies, said that they were willing to serve all children with subsidies, that they didn't face barriers in expanding and accepting additional children receiving subsidies in their program. You can see there are a few barriers that these providers reported facing, but in pretty small numbers.
I think the one that you've called out in looking at this that is important is the capacity fill with private pay and the long wait list that, so for some private pay providers, they just don't necessarily have the space, so that they'd be happy if they did to take more subsidized children.
Well, and clearly the relationship between staffed capacity, licensed capacity, and ability to take more subsidized kids is a dynamic.
There's triangulation
right now.
Then we also asked the 35% of providers who do not currently participate in the subsidy system about the barriers to entering the subsidy system. And we saw here for both group and school age programs and family child care programs, the most frequently cited barrier was their capacity was full with private pay children. And actually the top 5 responses were the same across group and school age and family child care providers. In addition to capacity being full with private pay families, that reimbursement rates are too low. There's a long wait list of private pay families. There's too much administrative work, and then not enough demand for subsidized care in their areas. And I know we'll talk a little bit later. I know about work to increase family access to subsidies, but to share that.
So when they
information.
say there's not enough demand, they mean that they're just not getting the requests.
So it could be latent demand or.
Yeah, exactly.
Or it could be perceived. We don't have kids who qualify for subsidies living in our communities, or there's no subsidies available in our communities.
But we don't know that to be true. Like, in other words,
We do not have we don't have visibility. And the converse is we've heard from some districts that have provided access to subsidies, saying that providers don't take subsidies locally and that they are trying to fill a need by serving those families through the programs that they've run. So there's definitely a dynamic. There's a dynamic in some communities going on there.
This was a forced choice answer. In other words, they picked that from a list of options.
Mm-hmm.
Okay.
Yeah.
And of these, the levers we have to pull are which?
I mean, we're going to talk a little bit about the subsidies. No, what's so helpful about having this data sort of frame up kind of what's the experience of the providers, and we're going to talk a little bit about the experience of families, and then figure out how to put that together. Are there some things? I mean, too much administrative work. That seems like something in our, potentially within our control. I think digging deeper into your question about demand for subsidized care, as we get a better sense of the data on the demand side, I think we can understand sort of whether there is in certain geographic areas, and recruit programs in those areas if there are providers. A lot of discussions in the legislature about the reimbursement rates, obviously, and even the relationship between a C3 grant and their ability probably to take subsidies is relevant. Turnover among families receiving subsidies, so some work there in terms of consistency and stability for our families. So that could also be potentially in our control in terms of how payments are made.
If we ever do this again, it'd be really interesting to ask if they don't currently have a subsidy child, if they have in the past, and why not now? In other words, some of this is sort of the getting under the hood a little bit, because the forced choice, like we've all been there, right?
Yeah.
I mean, it's a little hard to tell because it would depend on the degree to which they even understand the system or not. And I feel like if they've participated and don't now, that's a very interesting sample, right?
We didn't dig into all the qualitative comments, but that is an area that we could dig in and see if there were comments specifically on the subsidy side and see what.
I was thinking
providers
an
said.
open-ended would be very
Yeah, it was
interesting.
just-
Yeah.
without the forced choice.
Yeah, we did ask for the folks who selected other, we asked them to elaborate, but I don't have the deep results of that analysis here. But. Great. So last slide of C3 survey data, we asked providers what changes they would have to make in the next year in the absence of C3 funding. And more than 80% of group and school age providers reported that this would have an impact on educator salaries, either that they would have to reduce compensation or defer planned salary increases. And more than half of both group and school age and family child care providers reported that they would have to increase tuition rates and reduce discretionary program expenses in the absence of continued C3 funding. And then the last bar at the bottom, 17% of family child care providers and 8% of group and school age providers reported that they would have to close their program in the absence of continued or of C3 funding, which certainly demonstrates the continued reliance on this funding by a good subset of providers across the state.
Just a quick comment. I mean, all of these things would result in reduced capacity. So, whether you're closing or not, if you're cutting salaries or if you're directly reducing staff or if you're increasing tuitions, all those things, all point in the same direction. So, without being able to fully quantify it, it's pretty clear that if the program were to end in 2 weeks, pretty soon we would see a pretty sharp reduction in the total capacity, which obviously has huge implications.
For the economic recovery, for the kids who are already in care. And Joanie, just to reassure you, so that we'll be channeling you, that all of these things will also have a significant impact on the quality of the services that are being delivered. Right.
But and let's also just name publicly while we're all at the table that early education and care is still well in COVID. In other words, we are not in the privileged position of K-12 with high vaccination rates, and there is a lot of turbulence still on the public health front. So we ought to be thinking about this, we ought to be understanding this in the context of a COVID support at a time when we have months in front of us with COVID.
If I can just
Paul.
make a comment, I think this thing is excellent. Because for me, it's bringing the voice of the field to this conversation in a new way and, dynamic way. And I think we'll only evolve from it. But it does make me think of the Secretary's comments when we started about the budget process. And this is your advocacy slide for people that, are looking to talk to their local legislators about the importance of the funding of this program kind of going forward. So kind of ties together with where we are in the moment as well.
So this is the end of the C3 presentation, and I want to agree that excellent job by the staff here, and to be very planful in being data-driven about the impact of this program and testing the impact. And this information will be incredibly valuable to us in understanding overall strategies about the financing of programs and how we support their stability in the long run to support enrollment and quality and capacity for families. So I want to thank you guys and the team for all the work that you've done and how much this will. Are there any other questions for the team?
I just have one comment going forward, a little to Joanie's question about retention. As we look at the workforce challenges and opportunities ahead of us, to understand if salary increases are keeping people in their roles, if that's a lever that's successful, or are we naive that it's more bigger than that? So I'm just curious, as we kind of develop this data, what levers are retaining employees? So
It's a great segue.
Just to add on, Paul, I think it's that and more. I
Yeah.
think we know that compensation has always been our biggest nut to crack here. And until we address that in a big capacity, I think we're always going to have those questions. Yeah.
I also think the one thing that's worth acknowledging is this grant has shed light on, and I think exposed in ways that maybe many of us at the table have been clear on for a long time, but important as a general public enterprise. It's a business to run a child care, early education and care enterprise. And when you go to slide 10 with your pie graph and look at how they're using the dollars, you're reminded that it's a business at the end of the day. And I think we have so often been hyper focused on getting kids into slots and thinking about funding children when in fact we're putting them in a setting that needs to have its doors open and be a strong human capital enterprise. And I think this slide 10 is the first time I've really looked at data that breaks down the ways in which different sites are going to need it for different reasons, right? That's a mixed delivery system with different needs. So it's important to keep thinking about that too.
I'm sure I just make one.
Yeah.
I was talking to a reporter earlier today who asked the question, in some ways following up on what you just said, is, well, why are we giving money to these, private businesses? Isn't this a free enterprise system? Which I'm highly supportive of. But, what this really is a public-private partnership
right.
system. And therefore the role that
Yeah.
the state plays, the role obviously that this agency plays and this board plays is always going to be central to the success of the system and ultimately the quality and its quality and capacity. So this is different than some other industries in a lot of ways, but in particular because we rely on it so much for an essential service that we're providing to our families and children, that this is not simply a matter, if you will, of corporate welfare. This really is very much in the public interest.
That's right. I've always thought, it's hard to think of another sector where what you're doing is putting public dollars into a private enterprise, and you're depending on the private enterprise to build the infrastructure and then putting dollars into it. And I think what this exposes is yes, and we need support to build more robust infrastructure in the first place. And from there, indeed, we get those partnerships going for sure. Great.
So it's a good transition because as we think also about the role of the public sector and a public agency in the workforce part of this system, I promised last month we were going to come back and talk a little bit about the workforce. So rising to the top of everyone's agenda is what's happening in the classrooms and in the family child care programs, trying to hire assistants, trying to stay open, trying to hire staff. We have spent a lot of time talking to early childhood funders and legislators and programs and licensors, trying to think really hard about sort of what's the first step we need to be taking to really think about the workforce crisis right now, and also what's our job in the longer run. There are many very important initiatives happening at the community colleges, through neighborhood villages and other places, and I think we've been spending time thinking about what's our role right now in this moment. And I'm going to turn it over to Jocelyn again to talk a little bit about what we've thought about in the short term and also in the longer term. I think we have very much honed in on, in the short term, ensuring that we're providing a level of flexibility to programs as they're trying to navigate this very complicated, difficult to recruit, competing with other businesses. While in the longer term, really trying to land the plane around early education credentials and a career pathway, which will ultimately be the anchor and the puzzle piece for us to think about compensation and salaries and recruiting folks into a meaningful pathway in the long run, and for folks to be able to really see early education and care as a career for them, in the long haul. So I'm going to turn it over to Jocelyn to share a little bit about what we're thinking about in the immediate term, and then where we're headed in the longer term.
So I think just to frame up the presentation that follows, it's going to follow two parallel tracks of thinking. So the long term, where we're going with the credential and building out the pathways, but also the short term, where we recognize there's still a very urgent workforce crisis happening right at this moment in time. The that requires immediate response on our part. So, sort of thinking about both of those two things in tandem and how our next steps could tie those pieces together. And also recognizing that you approved temporary changes to the minimum hiring requirements back in December, and we did plan to bring, sort of an update on where those stood and what we've learned from the process of implementing them to you at this point in time. So thinking about those two levels, we want to support two parallel but equally important efforts to address system needs. So in the long term, we some of this will be review for you, but working to develop a framework for a career pathway that is inclusive and includes all educators and program types rather than being bifurcated across program type is stackable so that when educators are engaging in credit-bearing coursework, they're stacking the credits towards recognized certificates and degrees rather than sort of a one-off course taking at multiple institutions that we often see right now. They're transferable. They carry their credential record across jobs and roles and across different types of programs. So if you're in the FCC world, your experience and your certification at that level counts if you want to move into a center-based program. And that it's based on a competency-based structure. So we've based it in the NACCE competencies to organize professional learning and to focus on the learning that also happens on-site and through your job-embedded supports. But at the same time, we recognize we need to immediately continue to support the field with reduced barriers to support quick hiring, flexibility in hiring. And from this, I think what this highlights is the need to continue to encourage ongoing learning after hiring and the job supports that are available for an educator, with an eye towards the way in which the skill development we're supporting now is aligned with the future credential expectations. And that's what will continue to, that's where the quality sits in classrooms, is the skill building of the educator in the classroom, and that's an ongoing process.
Jocelyn, I have to say, I've been working many years in the workforce and professional development arena, and this slide excited me, I have to say, when I was looking at it this weekend, because it's simple, but it's inclusive of all the work that everyone has been working on for years. I mean, we've done this many, many, many times, but to see it all together, I think is terrific.
Thank you, and I'm standing on the shoulders of others on this one. I'm going to go through the next couple of slides quickly. They really are just a review of some of the conversations we've had in the past. But looking at the levers that we have to build the workforce system, if you start at 9 o'clock on the left-hand side, you have the credential there, which really anchors the system by providing the pathway and the vision for the pathway for educators. Moving up to 12 o'clock, access to higher education and the preparation programs that will support educators in moving through the pathways is essential. And our partnerships in particular with the Career Pathways grantees and Neighborhood Villages work that has been done to support access to coursework are both critical pieces of this in terms of making sure educators have access to the coursework they need right now for hire, but also support in moving into higher education pathways and moving towards degrees. Bringing people into the pipeline is essential, and thinking about educator recruitment and the ways in which we can both support educators in coming in and gaining the skill sets on the job as they enter into the field is essential. And there's a lot of really exciting work going on in the field in many different places that I think we've been hearing a lot about, and thinking about mentorship programs, apprenticeship type programs that we can also engage with and think through, as well as thinking about the ways in which we coordinate with mass hire boards. And then finally, the program itself and the stability of the program and the extent to which a program can provide stable and competitive compensation is really essential. And this is where both the C3 grants sit, but also some business training supports that we have been providing that continue to be very popular in the field. And this is just a very quick reminder of the overall structure of the credential is designed. So, it's mapping out 4 different levels of expertise rather than just focusing on the entry points to different roles, but also recognizing that there might be different pathways that educators will take at different points in their career. Looking at a degree pathway that really recognizes certifications and degrees rather than individual courses is one important part of that, but also having a pathway that recognizes and creates a structure and set of expectations for the types of skills that will be built on the job over the course of the educator's years of experience in the field is another important part of that pathway.
I was visiting an early learning program the other day, and I said to the director as we walked past the nice glass tell me about the educators in this classroom. And she said, well, that one's just graduated from high school, but thinks she wants to do early childhood education as her career. And so she's here working with us this summer. And that one just finished her sophomore year at UMass in the BA program to be an early educator. And I thought, right, we want both. And we want a pathway and an opportunity for both of them to grow and see themselves on a career path in the field.
Just flagging for another time, one thing we talked about when we looked at this slide a while back is just that we might think less about the notion of work experience and more about the notion of competencies, right? That the years, we might not lead with how many years because that may not actually tie up with competency, right? So just for another
It's a
time.
long conversation that I think we can think about in terms of how far we can get in competency.
Yeah, I think we've learned in other such fields that like the years doesn't end up nearly driving the
plus.
practice.
It's how you're using the years as well as what comes out of them.
Well, and if you
Documentation of the experience through the competencies.
The other part of it is, you obviously may start on the left-hand side and then
move to the right.
Right, and you don't want to have to go back to the beginning. So, this idea of competencies obviously allows you to translate from one side to the other, which is, important for a lot of people.
Well, and I think there's also this conversation at some point about whether, like, is the idea of the years just in service of getting the same number of years of training as the degree? It looks like it, but that's an odd, that may be up for grabs in terms of whether that's actually a retention strategy or not. Like, imagine that I hit the competencies in 2 years, right? That you could just sort of test out, if you will. So.
I should mention too, the secretary's urging, we're working closely with the Board of Higher Ed to engage the community colleges, both through funding that we provide to them, but also directly with the community college presidents. There's been a lot of conversations over many years about credit for prior learning experience, and they recently created a process for that for certified nursing assistants. And I think there's some interesting commitment for doing it for early childhood. To the secretary's point about, if we can figure out how to confer some of that credit for prior learning, they could go from the 2-year to 4-year and start to see themselves more on a pathway. So however we end up finally sort of framing up this path, I think, maybe it's not quite one for one in this.
Well, and remember that until you define the core competencies and figure out how to measure them, this is just a framework, right? That in the end, the real contribution is we figure out how to define the 5 to 7 core competencies of the educator, measure them, and then try to figure out that ladder, right? Otherwise, you may just be putting something out there that's not meaningful to child outcomes in the end. Which is sort of what, we've learned some of that from K-12. We've also learned some of it from the Kelly Aikens of the world on the health side, right? That in the end, like, this would be the easy part. The hard part is, what are the competencies and how do we measure them in ways that are reliable and consistent and, valid, reliable, consistent, and map to child outcomes, to quality in the setting on the ground.
But that is an important reminder, that mapping to child outcomes and thinking about, okay, if we're identifying 5 to 7, that's a starting place to think about what are the most critical 5 to 7.
Yeah, you need your anchor kind of areas and domains, and then be able to show that they're meaningful in the setting.
We looked at this a while back. And I'm wondering, Jonathan, you had said this is like the kind of 9 o'clock on your circle, so like a starting point. So what's the timeline for implementing practice? Or how are we operationalizing?
So I'll talk a little bit more about this later on, but I think if we can there are a few steps that we need to take. First of all, we need to spend time over the summer really talking to people about some of these questions that have just been raised and getting the experience from those in higher ed and those down on the ground in terms of what are you actually seeing, what's feasible and what's important in this structure that we've created. But then coming to a decision on what can be measured is going to be a critical step, in that if you need the verification process to actually structure the credential. And that is going to be what drives what people do and what ends up being the outcome of the process. So that becomes the focus of the work over the course.
Over the next, like, do you
Well-
have like a, by X month of X year, I wanna get to these answers, or how? Sorry, I was put you on the spot. I know there's
Yeah,
a
no, no,
lot
no.
of,
It's-
a lot of competing priorities too, but.
I'll put it this way, which is I think, as we've talked about, I mean, as I said in the beginning, and even as you look at that, all the parts of the system, like as long as we're working at each one, we're not sort of anchoring ourselves to this credential. And so it's kind of our priority to really try and get as far as we can this summer to lay out what this framework is. This is the catalyst for everything else. It is the anchor piece by which we have many funders and higher education institutions and employers and programs who are like, how can we help with the workforce crisis? And, in our conversations, it feels like we as the state agency leading around early childhood need to put a stake in the ground around what that career pathway is, so that if we were to fund more higher education, it's linked to you're going to go from level 1 to level 2, or a consortium of funders wants to come and help support early childhood workforce. Why don't you take a cohort from level 3 to level 4, or help people go from lead teacher to director? But without this mechanism to organize those resources, I think we're not going to be able to kind of organize them and leverage them for the field as well.
Would it help to put like a little extra board fire on it? Is that, I mean, can we say by September it's done? I don't, like, what's the driver of?
I wonder if I should jump it. I mean, because we've mapped it out, some of the steps.
I just wanted to say that, just to add a comment, that this issue is not exclusive to EEC by any means. So, I work in health and human services, and this is across the board. This is for school-age children. This is for the adults. And so everybody is competing for the same people and for the same bodies to get them to come and work and support the work that they do. And I don't know what happened to all the people, but we are suffering from a workforce crisis like we've never seen. I mean, I don't know if it had to do with everybody getting unemployment benefits and they stayed home longer, but you would think that would have abated by now. And it's everywhere though. And I mean, it's in our group homes, it's in our schools, it's everywhere. So this is not, and it's sort of like, so what can you offer, right? I mean, if you can make more money in Starbucks than you can doing direct care work, and let's face it, it's a lot less stressful, right? We're asking people to do very hard work for very little pay, and we're seeing the results of that, which is people are not willing to do it like they were before. And it is across the board. I just wanted to say that.
No question. But
We're
it
all
does make
struggling
me,
with
it does make me think, like, if you go back to the building a workforce system, when we get talking about the measurement piece, like, that's not a September, we're not on a short clock, right? So it does make me think that there's reason to dial up some of the initiatives on the right, perhaps in connection to, which is, if we're thinking about apprenticeship, those are programs where you could do some piloting and inform some of the design of this system. In other words, I just wonder if, given what you're raising around urgency, and I appreciate on all fronts, and I appreciate the systems building as sort of, getting to something macro, I just wonder if we're really talking about 3:00 and 9:00, and the two are connected.
And I don't think we have to fully answer the measurement challenge and map out the full verification to start knowing what it is that you are driving for through the preparation programs, the support in the program, and the pipeline.
You mean
Yeah,
the
I think this
you mean
is
the
long-term.
competencies?
This is
Yeah,
a long-term
exactly.
issue, and I think the issue too is that it's gonna require a lot of creative thinking and a lot more partnerships. I mean, personally, I feel like early education is something that's more ripe for private investment, because getting people to be able to work in the private industry requires that childcare be available to employees. And, so there's that incentive there, and how that works remains to be seen, and what investments they're willing to make. But it's also going to be one where we look at, so if it's not the pay, or quite frankly, even the career path that is an incentive for people, so do we collaborate with higher education so that there is tuition relief and people are able to achieve a degree through service, right? I mean, it's gonna require a lot of that type of thinking that, is unprecedented in the same way because of the nature of the crisis that we're currently facing. We're gonna have to do big things to drive people into the workforces where we need them, and what we've had to offer so far is proven to be inadequate to date. So, but it's not something that we're going to solve, certainly not by September or anywhere near there, only because it's so broad. I mean, I can see coming up with things to offer, and sort of what can we offer short term, what can we offer long term, but it's going to be a building process over time, and sort of just bringing in partnerships.
Force a little bit of a deadline sequencing, because it is
Yeah.
going to be staged work over time.
But I think that building those partnerships, particularly with the private, private sector, that's going to take time, and it's going to have to be something that's cultivated and sort of, it's almost like, fundraising. Once you get one, then you get another, and then it's sort of that building block. But we're at the beginning stages of that right now.
Joanie?
I think another lever we might be able to pull, in addition to the huge one of the economic mobility and the workforce of families, is student outcomes and the readiness and the whole pre-K through grade 12 piece of it, is that we're not just taking care of the kids in these programs that we're trying to maintain. We are providing an educational service to these kids too. And so that link to our sister departments, I think, is even more clear.
And I think the pathway does that too, in a professionalizing way for the field. I mean, I think without, we will continue to compete with Starbucks and Target unless people see this as a career, right? If they're making a decision between $20 at Starbucks or $18.50 at, Little Friends Early Learning Center, but they can see that at Little Friends, they can get this when they become a teacher, and that when they become a lead teacher, and that when they become a director. And I think that's what's driven me towards a focus on sort of the professionalizing and qualifications, so that people can really, like, if we did a big recruitment effort right now, worked with our private funders and did a big recruitment effort to the current situation, I'm not sure we'd be helping anybody. I think we need to define what that is so that we can recruit into a pathway that's meaningful, where people can see themselves staying. And but it has to be. I mean, part of what and Jocelyn can go on to is how we figure out how to do this parallel work at the same time, right? We have a crisis right now. How can we do some apprenticeships and some recruitments while we help really figure out how to professionalize and define that pathway? So, and I think one of the things we needed to share with you today is a decision, a revisiting of that decision around the minimum hiring requirements that you made that allowed some flexibility for the field, that we're recommending continue in the short term while we do this longer term work. So do you want to go to the next steps for the longer term, or do you want to stick to where we are?
Why don't I actually go through as planned, but we will come back to the conversation that we just paused. Just quickly, this slide maps out the current regulations, which defines what we've called the certification system, and that highlights some of the key characteristics of the situation of that current system that led us to the place of thinking about the minimum hiring requirements. So experience and coursework were defined by program type and role. There are a lot of different set of expectations for different roles and types. Required courses are based on defined courses of study, and there are a lot of requirements about credit-bearing courses, with CEs only allowed in some limited circumstances. And work experience is also limited to specific settings and age groups. And at the same time, we had a very small unit that was reviewing all applications for qualifications, and that just, created bureaucratic delays. In particular, that, talking to that team, they experienced there wasn't an IT system that was really structuring and scaffolding the process for applicants. There was a lot of back and forth, like, well, you're missing this documentation, and we need this piece of paper, and so it just was a very time-consuming process. So the decision was made to make some changes and build in some flexibilities that would hopefully alleviate some of the challenges the field was facing with that system, broadening the way in which programs could determine the requirements, putting in place less restrictive and more responsive ways for educators to engage in preparation and coursework, particularly in calling out ways in which educators could start working and then complete coursework rather than having to have everything completed upon hire. Also expanding the specific common courses that qualified for rapid hire, and thinking about flexibility and the types of work experience that qualifies an educator. And at the same time, operationally, the decision about whether an educator was qualified transitioned from a centralized process to program leaders, where leaders could validate qualifications at hiring, which allowed an expedited hiring process and put more control over the process in the hands of the directors. So we've been spending a fair amount of time talking to people who've been using the system, both speaking directly to programs. We spoke with the Workforce Council about this, and talking to our partners who are working with educators and receiving a lot of the questions about this process. We're hearing overwhelmingly that, continued support for a quick hiring process continues to be essential. This is a field that's struggling to hire educators, and any barrier to the hiring process is a challenge. We can't return to the delayed timelines that a centralized qualification review process created. At the same time, it isn't clear whether the breadth of flexibilities that have been provided to the field are fully being utilized by the field. And providers do need technical assistance in figuring out how to respond to some of the very complex hiring decisions. With flexibility comes complexity. And there are a lot of decisions about whether this course counts, or do I credit this particular type of experience for the educator, that are coming up. And, people want somebody to go to and talk to and ask and get some help in thinking through what should count. There's also concern, particularly on the part of the educator, that with many, many different people making these types of decisions are not necessarily going to be consistent from director to director. What if I, as an educator, leave and go to another program and there's a different determination being made?
Determination about
whether they are qualified to be hired. Because they're
yes
no
or
longer
no
coming.
qualified.
Yep, they're no longer coming with a certificate saying this is a qualified educator. There's a review of the process. And I mean, questions are coming up like, should I keep my own file as an educator? Like, yes, you should absolutely keep your file of your qualifications.
Once you're qualified, you carry that with you.
But we're not issuing certificates of qualification right now. That was suspended.
I know, but
Yeah.
even if we're not issuing that, if the determination is made, that would be part of like.
That if one director made this determination, that there is a way that it carries through.
Sort of honoring it.
Yeah, I mean, I think we would need some sort of a centralized system to record that decision, but absolutely, I mean, it seems like there are steps that we can take to
Yeah, I don't know if they could like personnel files or anything.
streamline.
Sort of like, no one wants to start over again.
No, absolutely not. And, people don't always want their new job.
But how
contacting
often,
the
like,
director
do we
from
think
their
that's
prior job.
frequent, that the next director would question?
I don't have a sense of frequency. I mean, we're in the world of, sort of anecdotes in terms of what
Yeah.
people are worried about and what they've heard happening. And to the question that I asked the group today was just, how much is it also about nuances on what counts versus like significant differences on what an educator could be bringing, to their role. The other, sorry, go ahead, Joanie.
Just thinking out loud. When you say you spoke to a group of people, is it like focus groups? Are you collecting?
Oh, I was talking to
data?
PDCs today.
Okay, okay.
So we're engaging with our partners and as well as the Workforce Council. But I mean, I think these are conversations that we can have with more targeted questions, I think, as we move forward in thinking about what would the changes that we put in place and what would be most effective if we were to make changes.
Well, and I think it'll be important to articulate your real questions. Like what are the questions where there's a bottleneck or where there's a pressure point or something, as in order to think about the agency's bandwidth and resources.
Yeah, coming with a set of thoughts about where we're going versus open-ended questions, which is largely what we've been looking at right now. We've also heard that there are many educators that are interested in continuing their coursework and training and want to know what their next step should be and sort of what should they be taking to continue their professional advancement. So that circles us back to the need for a clear pathway and recognizing everything that we just said about where we stand with the development of the credentialing work, revisiting the ways in which we might be able to provide some temporary or sort of transitional clarity to educators around what courses might count. I mean, we can certainly review available courses, and we have done this in the past. We could do it again to think about, starting to identify what training packages, what credit-bearing courses, in addition to what we already have identified, could potentially count in different ways. Also thinking about, do we need to return to some sort of a centralized process so that educators are not starting over every time they go to a new program.
So we sort of teed up this question thinking as we were preparing for the board meeting, like, do we want to go back to what we had before, or do we want to keep what we have now? And we were like, no, we need to find a path from where we are. We can't just flip the switch back to where we were. I don't think that's where we want to go either. So I think the work Jocelyn's going to present now is really thinking about how we go from current to a future state.
Some of these are very short term. Like we are in the process of putting in place a system to provide more extensive technical assistance that brings the teacher qualifications team together with the quality team to engage with programs to think about both, concretely, what support do you need in reviewing the qualifications that this particular educator is bringing, but also how are you then thinking about growing and building and developing the skill set, particularly if there's a need for coursework to continue in the qualification process, but also in the long term, building into the thinking about how one as a program grows and builds the skill set of educators. The professional development registry that we have also spoken about before could potentially provide an opportunity to centralize some of this. It is effectively a place that could be a shared document library, like a digital filing cabinet, whereby the directors, the educator, EEC all have access to that core set of documentation that can support qualification decisions, so that it isn't about an educator keeping their own personal file and then having to justify it, going from job to job, that there is some centralized access to the information. It could also eliminate a paper-based review that has been central verification process and could streamline that process. So there's certainly an opportunity to do a pilot launch of the registry if there are educators and programs that are looking for that type of support.
We heard from the programs, basically, like there are some who have the capacity and the HR, they're large enough programs to be able to do this work. They were happy for the flexibility. We'll do it ourselves. We didn't want that backlog up at EUC and TQ. And then we've had ones who are like, I don't know how to weed through this stuff and it's taking me away from program and I got to be in ratio and classroom. And so could you come back and help us in some way? So it felt like a step towards, without going back to where we were, and an opportunity to kind of correct in some ways. Like, the idea of EEC issuing certificates is not a bad idea, right? We want to professionalize the field. We want someone to feel they've been recognized, but we can't do it the way we were doing it. So I think we want to spend time thinking about what that could look like that would be responsive to the educators and what they have asked for, and to programs who are trying to figure out if staff are qualified to work there.
So do you all file this under sort of like retention? Like, where does this fit in your overall workforce development strategy? Like, where does this set of next steps sort of, like, how would you classify this work? As retention work or leadership support?
One step before retention work, which is supporting the field and getting the educator in the door. But I do think there is also an opportunity for an element of leadership work to be built into it, because the support is being provided to the educational leader in the program around hiring and then ongoing support decisions for their educators. And that, I think, is a space that we have developed a number of supports around and would like to continue to build out. And it's just an opportunity to engage in a slightly different starting place, but still, I think, a critical place.
It's also making sure that they're valued, right? I mean, there's something, if you're qualified as something, you feel there's value to that, right? And so, and it's somewhat transferable. Like, whatever next job you might go for, saying that you were, yeah, you were a qualified educator. I mean, that means something.
The other place I'd put it is with the directors. So we've heard a lot from our licensors and in our programs about how much directors are struggling. They can't keep staff. Like, again, they're working in the classrooms when they don't have enough folks. So I think they're feeling extremely stressed. And if there's some support we can provide to them in the hiring process, maybe that is,
And these complex hiring determinations, is that like the first order problem? What is that, when you say complex hiring determination, like, can you give us an example?
So an educator, yeah, I can think of one that, I mean, so you have sort of a handful of training and maybe some credit-bearing courses that you're coming and saying, hey, do these collectively meet my lead teacher requirements, whereby there are a set of CEUs that you need to take across a number of different courses of study. So to resolve that, you need to know what are those trainings, what was in those trainings, like what was the training actually focused on, what's in each of those courses of study, how do you cross-map the training to the course of study, and then make a decision about whether those pieces count. It's those types of issues. It's mapping to the courses of study, and then also figuring out what experience matters and should count as well.
And the lead teacher is set out by the state.
So we've defined the courses of study. That's the sort of current regulations right now.
Thanks.
Yeah.
So is what they're doing discretionary, or is it, you know what I mean, how well is it defined? Because when you're saying cross-mapping.
Yeah, I think we could help with the definition. That is a place that I think we could do more right now. Yep. So this is getting us back now to some specifics on the longer term thinking. Finalizing the structure of the educator credential. So looking at this, we're thinking it's probably, sort of a lot of engagement over the summer and then through the second quarter of 23. The pieces that I've mapped out, and, Joanie and everybody appreciate some of the input and thoughts about this thinking. But really, being clear about the competency, I like the idea of trying to really, really focus and think about what's most aligned to child outcomes. Clarifying some of the degree expectation. There's a beginning map in that, but there's a lot of details that need to be mapped out on that side as well. There are some questions that have come up around endorsements, particularly recognizing those with infant toddler experience, which is something that's really important in our field and not explicit in the credential. But also on the leadership side, the credential itself runs from entry level to a professional with a level of expertise and skill set to support others in learning, but doesn't necessarily call out specifically what one has to do in an educational leadership role. So there's another piece of that experience that's needed. And there are others as well. We've, had outreach from those from the early childhood mental health space with a credential that's been developed an endorsement that's been developed that's of interest. So thinking through some of those pieces without creating a system that's too terribly complicated, but that gets at the critical components.
Decision-making ability of the board, or is this something that has like federal regulation implication?
I think it's within our purview to make these decisions.
It's always better.
Yes. I mean, eventually the key step in all of this is looking at the regulations and making the changes that need to be made in the regulations.
Yeah, I just didn't know if we were constrained in a particular way, and if not, then that's. I mean, obviously, if we need to provide further clarification, we can and should, right? But I was just wondering if there were constraints around the ability to do that.
No, I mean, we will obviously have to crosswalk and map with the expectations, but there's nothing that is really going to set boundaries on our ability to do this work.
Yeah, I've read them recently, so.
Keep it by your bedside.
So I go ahead, Joan.
I was just gonna say, I think it might be beneficial to look at, we have some of this information in many, many different lockers, right, over the years. For example, we have infant toddler certificates at institutions of higher ed, particularly community colleges did that, school age programs. And so I think we don't have to reinvent the wheel for all of this, right?
No, I think it's a big organizing.
Yeah.
It's an organizing and execution exercise. We've been talking about it for a long time. There's been a lot of work on credit for prior learning. There's been a lot of work by this board, this team, and many others. And I think we want to try and bring it into fruition. right? And try and link the pieces together and organize it. And so, which is not going to be easy. And I think we're all sort of feeling the discomfort of like, there's no easy answers for the workforce crisis right now. But I think the best thinking we're presenting to you is to say, we have to maintain some flexibility while getting out there and supporting providers to hire qualified staff. And we can use that opportunity to build the pieces that we expect to have in the future. Like, what will TQ potentially look like? How can we launch the professional development registry to inform it? So the team's really designed the interim steps to be things that are hopefully meeting some of the immediate needs while laying the foundation for that longer term. But I don't think we're not going to do any one thing that's going to get a bunch of folks recruited into the field immediately and happily staying in early education and care programs. But I think we're on a good start. But
I would do, go ahead.
I was just gonna say, I think this is an excellent plan, right? It's organizing and executing the key of this plan is helpful to hear, because I also know there's been, at bats of this effort for a long, long time. So I'm curious, what are the potential barriers that are gonna get in the way of delivering on this, whether that's inside the agency in partnership with working with other agencies? What should we anticipate, try to get ahead of?
I mean, we need support to do this work. Yeah, our staff internally is not going to do this work, and I think, there have been.
We need additional capacity, I think, to help us, whether that's probably both internally and externally.
yeah. And I think part of it is probably going to have to make some hard decisions about where to start.
How big is your
Right.
legal department?
How big is our legal department? 6 lawyers?
4 with 2 potentially coming on board in the interview process? Yeah, that's.
I'm thinking future, Janice.
Yeah.
6.
So internal capacity, or capacity, what else, like is higher ed prioritization, or?
Yes.
Yeah, I think getting higher ed to the table to meaningfully do this work, and we're a little bit on that path, which is exciting. I think there's some good work and there's been work done.
Yeah.
Yeah, and I think the external pressure around early education and care right now it provides us with the organizing and execution opportunity that we might not have had in the same. We're under a lot of pressure. I mean, you could put more pressure on us if you want, but I mean, the field is under a lot of pressure to be able to do something about the workforce because it's keeping people from being able to go to work.
But it also assumes that, I think that the only thing that I'd say, I couldn't agree more on all counts, and it means that there's a lot of eggs in the basket, that the pathway is what's attractive to the user, to the potential educator. And I think it's probably a both and. Like this actually may appeal more to those who are already in and who can sort of imagine then how to layer and how to stay and how to grow. And I think there's also this, like back to your 3 o'clock on the workforce development strategy, I still think there's a lot of room for thinking about how to recruit in really innovative ways, right? And at what point and which places or what's the profile, and how do we expose what is ultimately often an invisible field and a different and a profession that is not particularly well articulated out there. So I think yes to
Marketing strategy.
Well, it's true that I think there's some room for like lots of nudgy kinds of things that might, also just bring people in who may be rather mission driven, who may rather do this than something else. But so I think it's a both and, because I think this really relies on an assumption that having a pathway is the problem. I think having wages and a really supportive place and innovative place to work, the lots of the literature would tell us it's a lot more about the conditions than it is about understanding my own growth path, right? And that I'd actually rather stay.
I see it
for
sort of
fewer
like
wages.
people that are going into higher ed and they want to be a teacher, right? And while they're going to school, they could work in early education and get credits for it towards their teaching certification. And then some of those people, as life is, will go on to be mothers and want to potentially work in childcare, and that they would be able to bring their own childcare or even start their own, because they would have that experience on both sides. And there is flexibility in terms of that type of work, in terms of how many days you want to work or things of that nature. So I just see like coupling things that already exist to create that pathway to service. And quite honestly, having a career pathway is much more meaningful to someone rather than just, grasshoppering across different jobs
Right.
in your younger life, which I did.
I think it also provides a structure around which the internal support that you receive as an educator can be structured for programs too. I mean, it provides a roadmap to the types of training and job experiences that you should be having as you're building your skill set, that I do think we can also wrap supports around and, kind of build into the infrastructure
Right.
at the program level. Recognizing that, we also need to pay people and have a system where directors aren't always in classrooms.
And also though, like we need to remind ourselves as we go into this, because I think sometimes it's easy to lose sight of the concrete. The reasons people leave and stay have everything to do with wages plus conditions, right? And the conditions is the lever for EEC, right? I have a supportive director. We have clarity around the way we work together. We have shared norms. We have ways of we feel psychologically safe, et cetera, right? So we just don't want to lose sight of that as ultimately the reasons people stay and go. So I'm mindful of the time too, sorry.
I mean, I guess I don't think the career pathway is going to solve it, but I do think it'll help us build the solves around it. But that without it, it's harder to bring the resources in, to direct higher ed in the direction we want, to recruit folks to the field and see themselves. So I 100% agree. It is not going to solve this, but you could imagine a future where we had this career pathway and we tied some kind of salary expectations along.
Yeah, I mean, salary and competency would be the innovation. That would be the leadership role for this state, right?
So, yeah.
Secretary.
I think the only thing I'd say, I think, which is consistent with what the chair was just suggesting, is that ever since I've been in my role, which is now 7.5 years, we've been talking about this. It's all good. I just feel like in some ways we're trying to overshoot the target, which in some ways gets to the point about, wages and working conditions. Of course, we can influence working conditions maybe. We can't really control them because they're very localized. But instead of thinking maybe about the latter, other than having it in our minds, we probably ought to be thinking about some of the individual rungs. Like what can we actually get done now that's more proximate to where the pain point is, and then worry about the other stuff later. Because sometimes it feels like we get sort of caught up in trying to design the ideal system and pathway, if you will, when all we really need, not all we really need, what we really ought to be focused on is how to help people take the next step.
That's why we've been talking about it 7.5 years.
Yeah.
Well, and let's also, I agree, because I think the other piece is, let's not underestimate that some of those rungs are really tough nuts to crack.
Yeah.
So I think that is the question, like what's the first order problem that that would unlock other pieces of the
And what
rung?
can we do immediately?
Totally.
versus,
This
you
is
know,
the 3 o'clock,
Yeah.
9 o'clock, yeah, no.
And your idea of pilot programs is one way to really get into it quickly. It's something that is a doable option.
Okay,
Paul, you gave me the floor about 20 minutes ago, but you were about to say.
You know, I was just gonna say, amplify everything everybody said, but even, Joanie, to your point, how to leverage this board, right? Like, I think we all get up every day talking to people that are thinking about this topic. And so locally, there's lots of talented people out my way, like, how do you just leverage us to, again, continue to be a thought partner and to try some things with local connections as well, with people that just are yearning to do some of this stuff, so.
all right, thank you, Jocelyn, Adrian, well done. Before we take a break, Joanie, it is time to recognize you for just a moment. Today, publicly, we recognize Joanie Block's tremendous service in her role as a EEC board member for more than 2 terms, and her work as a very strong advocate and practitioner, high-quality, on-the-ground work with children and families. After more than these 2 terms on the EEC board, and including many very crucial professional roles and a series of key ways to support the Commonwealth's children and families, Joanie is both stepping down from the board, but as a function of retiring from her position in Brockton, which therefore includes her work on the board in the MTA AFT seat. So, Joanie, as part of our token of appreciation to you, you will see in here personal notes from each board member. And I just wanted to say that the through lines are so clear. Your lens on children and families, your dogged push for the early education part of early education and care, and your focus on access and equity. And I think, as I said in my note, that when I met you over 6 years ago, I think our first conversation was about assessment instruction links and the learning and teaching, the inclusive practices. And I feel like we've been having some version of that conversation in wonderful ways ever since. I am inspired by, and I know we will all miss your energy, your enthusiasm, and your great questions. So thank you for all that you've brought to this table and by extension to the Commonwealth's children and families. We wanted to do this before we break because the wonderful Andrew Rome has baked some cakes. We'll take a break. We'll toast Joanie, and then we will continue with some regular business. But Joanie, thank you. Service. Thank you, Joanie.
It's been
Yeah.
a privilege and an honor. Thank you very much, everybody.
Jamila, Dave, we're going to take a short break. We'll be back. I think we will start again by 25 after, because then that'll give us an hour. Joanie, thank you.
Thank you. Sounds good.
Thanks.
How are they gonna get their cake?
They're not getting Joy, Michael, nice to see you both. Thank you. I'll turn it over to you.
That'd be
Okay.
great. Sorry, I'll kick it off for them. So,
Great.
as
Sorry, Jamila, you good? Can you hear us?
I can hear you.
Thank you so much.
Okay, thank you, Madam Chair. Really pleased to be here to provide you an update on our work looking at the subsidy system. As I mentioned at our last meeting, we are fortunate at EEC to have 2 project teams assigned from the Governor's Strategic Innovation Group. One is helping us with the background record check project, and we'll have a greater update for you on that in September. And the other is really helping us do what is a necessary end-to-end review within the child care financial assistance or subsidy system. So we have a team working. We're going to provide you with an update of the focus of that work, and talk a little bit about what the next steps are in the short term. So I'm really pleased to introduce Joy Cohen, if you haven't met her, our Director of Policy Development here at the department, and Michael Kelleher, who is a floater in some ways in state government, but on assignment from the Governor's Strategic Innovation Group. So the project team is structured to be a partnership between sort of in-house consulting from folks elsewhere in state government and our in-house experts. And they're going to walk you through a little bit of what we're learning in the review of the subsidy system. And I'll just say for a second that, you go to the next slide, that one of the, oh, I already walked through that, sorry. So, one of the key triggers for us in this work was really looking at kids enrolled in the subsidy system. So at a high in July of 2019, we were up at almost 59,000 kids. In January of 2020, we were closer to 57, and now we're down around 49,000 in April. So really an opportunity for us to take a look at what are some of the barriers to families getting enrolled. Many families are on what is a wait list, 17,000 families, but there's a lot of data and things that's needed on that. And the department has funding to be able to support a return to pre-COVID levels in terms of families accessing childcare financial assistance. So we wanted to take a deep look at what was happening in the current system. We have about a year wait in some places on that waiting list right now. And we know we have some capacity issues, but we also know from the C3 survey that there are providers who are willing to take additional subsidized kids. So really a key focus of us is helping families who may have jobs that they need to keep or new jobs and being able to get them access to that childcare financial assistance. And big opportunity to bring kind of a fresh look from the team that's been working on it. So we presented some of the caseload trends in terms of the overall subsidy system. What this chart does is look at by the different programs. So we serve overall income eligible kids, but we also serve families who are involved with the Department of Children and Families and those who are participating in employment related activities with the Department of Transitional Assistance. So you can see big drops across all programs, but kind of an uptick. Slight uptick in the last couple months, and we hope to be seeing that trend go up further based on the work of this group. So Michael, Joy, take it away.
Thanks, sir. Thank you, Secretary, Commissioner, Board Chair, Board. Pleasure to be here this afternoon. Really excited about this conversation between Joy and I will have with you. So to start this topic off, so I kind of just back up a little bit from this slide. I have a son who plays soccer and has me drive all over the state because he loves to play soccer. And this weekend I was driving God knows somewhere, and I thought of what we're doing, and it comes down to 2 sentences. And the words of how the words are arranged in 2 sentences. So let me try this out here. What we're doing now is applying federal, state regulations, financial rules, and reporting requirements to the development of EEC policy, procedures, and processes in order to meet the needs of the family. What I think we're trying to do, in the charge I have from the Commissioner, and she's hearing this for the first time, so she may get is meeting the needs of the families through the development of EEC policies, procedures, processes, while applying federal and state regulations, reporting rules, financial requirements. Just those change of words and using almost the same words. I tried to be one-to-one, but don't check me, I don't think I did. But those two sentences is kind of how we're looking at the world from our perspective, the subsidy group. Like I
I
said,
think the other thing I'll just chime in before you guys get started is that, you know, a lot of what we did before we got started here was recognize that there are a number of reports existing that are looking at the subsidy system and have recognized kind of significant challenges for families being able to access and retain. So even before kicking off, I think these guys did a pretty thorough review of some of those existing sets of recommendations or reports about some of the challenges families were facing in accessing subsidies and maintaining them. So
exactly. Starting off point, Commissioner, when we started this work 8-9 weeks ago, we looked at what was written, what was already existing in various forms. We had the EEC strategic plan. We had previously conducted family surveys. We had a special legislative report that was published, I believe, in March of 2022, as well as the existing policies, procedures. We had a lot of material. So the first thing we did, as the Commissioner mentioned, is just go deep dive into all the written material just out there, because in my perspective, and I've worked with the Commissioner, multiple agencies, the ideas are often already there. It's just figuring out how you arrange them like a cake in the right manner to make such a great cake. But the ideas are already there. They need to be brought forth in a different light or maybe rearranged in a different way. That's where we started. Then we took that and created and started what you're seeing now, a bit of the beginnings of the stakeholder engagement communications. We started talking to subsidized providers, Mass 211, CCR&Rs. We've talked to advocacy groups. We've talked to state associations, more of kind of the trade associations, if you will, the Family Association for Early Education of Young Children. We talked to Horizons for Homeless Children. We've kind of taken these ideas and communicated as well and caught more ideas. Talked to EEC staff from across the gamut and really understand where we should be focused. I'm gonna hand it over to Joy, because Joy's gonna talk about, okay, you've had all these conversations, you've read all these materials, you've collected all this information. Where are you now? And that's what Joy's gonna talk about, our initial areas of focus. But I do want to stick on this side for one more second, in that this is not a one-shot, we're gonna talk to you and go away and think we know everything deal. This is we're not fully through all this. You'll see complete versus underway or planned. On the docket, we have to engage more with families and key stakeholders. We need to conduct interviews with contracted as well as providers that do not have contracts with the EEC, understand why. Obviously, we can go back to the great report that Jocelyn provided in terms of pinch points and barriers. So we're going to feed from that information. We also want to collect feedback on the existing IT systems. That's further down the road. So this cycle we're not done with it. We're just kind of halfway through, if you will. But the big part I want you all to walk away with is it's not a one-shot opportunity to talk to advocates, to talk to stakeholders, to talk to the key voices. It's going to be a reoccurring cycle as we go through. What about this idea? What about that? What would you do if we did this? So that dialogue with those providers, those families, what have you, is going to be ongoing and constant. So with that, I'm going to ask Joy to go through what we found so far.
Great, thank you, Michael. So again, like Michael said, these are issues that there has largely been consensus and agreement on from what we've heard around what we should be looking at and looking for in the subsidy system. So I'm going to go bullet by bullet. We heard a lot that we need to focus on simplifying the application, reporting, and verification requirements, and that we need to ensure that placements into childcare are informed by and responsive to the needs of children and families. So one of the ways that we're thinking about how to do that is by streamlining the application process. We essentially took 8 different documents and consolidated into one document that will serve to identify all of the components that you need to verify eligibility and make an informed placement that's going to impact the child's development and be appropriate for the family. Another area where we heard that we need to look at is aligning and integrating policies and systems across programs in order to facilitate and support understanding for families and support them with navigating what is essentially a very complicated process. The ways that we're approaching that seem like they may not be very impactful. And one example of that is by looking at how we define certain terms differently than how our sister agencies define certain terms. So one example of that is assets. The way that we define assets is very different from, for example, how DTA defines assets. So a family that's navigating DTA and EEC needs to learn two different definitions of what assets are. And so how can we address those discrepancies and streamline for families? We're looking at Kinderweight, the wait list system, and also looking at how we are defining priority groups to better enable us to serve those families who are most in need of subsidized services. And this is also going to allow us to be more intentional about data quality and collection to inform those services for families. So really being intentional about the data that we're collecting. We are working to examine customer service, to identify opportunities to improve our communication with families, increase flexibility, make quality improvements, and be more efficient. One example of that is looking at expanded hours, making sure that families may not need a hard copy of their signature, that we can accept digital signatures across the board. Things like that can expedite processes for families. And we're also looking to analyze current eligibility thresholds to identify barriers to access and to better understand and expand access to care for families in specific regions, for specific age groups, families needing specific hours of operation. So one of the ways that we're thinking about that again is how we're defining protective services. We have the discretion as the lead agency to define protective services. That's not something that the federal, our federal obligations don't allow us to do. So who we include in protective services, and then also thinking really strategically about how we can incentivize providers in certain areas so that we can address sort of the Massachusetts childcare deserts and be proactive. So beyond the broader sort of capacity issues, these are the systems issues. And so one of the questions that we're coming to you all today with is, do these issues resonate with you? Do they sound right? Is there anything glaringly missing from your perspectives that we should have on our radar?
I guess I'll just jump in too for a second and say that I think, these guys are pretty deep in the details of it, but I think what we've discovered is that we have a fairly challenging system for families to navigate. There are a lot of verifications that don't match what other agencies do necessarily. They may exceed our federal requirements in some cases, and that there are ample opportunities for us to simplify that process and make it sort of more human or family-centered.
I'll just comment. I mean, I know in the field you hear a lot about the wait list. So any kind of attempts to get our arms around that, I think, is just a step in the right direction. And I also just like the lens, I think, in which I tend to operate, and I think you're doing with this, is kind of the user experience, right? Is families across the Commonwealth, they look at government as a whole. We look at it as department by department.
Line item by line item.
Yeah, and so, to get common language and to do that, I just think only helps do what we're here to do, which is to help and serve people across the Commonwealth. So just like the directionality of some of the work that you've presented. It's great.
I'm all for simple, so thank you.
Yeah.
Focus on the next step.
Any other comments?
Yeah.
Questions? All right. So next slide, I had a mentor who would always kind of come up with these great ideas, and he'd say, okay, what's the point? What's next? What are you going to do about it? This is our answer to those three questions, if you're thinking about those questions in the back of your head. How are we taking this information, and how are we thinking about the areas of focus in terms of next steps? So the first, and what's interesting about all these three is I'm going to do them 1, 2, 3, but they're very, very interconnected. The first is to identify potential solutions, potential supports that we could provide families to going through the intake application, the process, how they get a letter, and how that letter translates into a seat. One thing that we noticed right away when we were looking at how the CCR&Rs and other subsidy administrators send these letters and conduct this outreach. They send a letter and they kind of wait. Now, I know that works well for Santa Claus, and my kids at least, but that's probably not enough in this environment, to expect a family who's dealing with so many different things and getting a letter and saying, okay, this letter is more important than this letter, what have you. How do we conduct outreach, technical assistance in navigating the process? As Joy mentioned, we have a new intake application. We're trying to converge a bunch of forms into one. We're going to try to identify that and deploy it pretty quickly. And there's some things that we can deploy pretty quickly in real time. Secretary, you said don't wait for the perfect. We're not waiting at all. We're going and taking some of these ideas that we think make sense, and we're trying to deploy them as soon as we are ready to do so, and doing deployment, measuring these, using the family experience to identify whether or not these worked or not, iterating and improving these types of solutions. Our goal is to just identify these ideas, put them into the field, put them into the cycle, evaluate whether they work or not, change if need be, or they maybe become more permanent. And that's where it kind of flows into the other threads that we're looking at. Our goal here is very simple. It's to make the intake journey as simple, as effective, and as efficient as possible, removing steps, removing verifications that may not be required, just taking out all those barriers that we have in front of us and trying to just clear out the field for families. So get people in, as well as shorten that time from, I call it letter to seat. Very simple. From the time you get a letter or the letter is issued, how quickly can we get that timestamp from letter going to the mail and that child or family getting the seat that they need? I know there are other more complicated measurements. We are going to be more complicated, but from my simple perspective, that's what we're trying to understand.
Michael, what is the number you want that answer to be?
Unfortunately, we don't know what it is now.
Honestly,
1 year wait time.
Oh, yes.
1 year.
For some families, and for others, it's different. Yeah, it's by region a little bit.
trying to get a handle on what that baseline number looks like.
But like even with what the baseline is, like what should it be? Like what?
Well, so for some families,
Direct-
it should be immediate.
Immediate, right?
Yeah,
Mhm.
for some families, it should be immediate, but it's a great question. I think as soon as they're eligible, as soon as they've been determined eligible to receive a subsidy, I think it should be as quickly as they can find a spot to go. It should be driven by the family's timeline, not our bureaucratic timeline, I guess I would think.
And I respect that position so much, because I've heard of too many families that have to drop out of school or leave their position because they're not getting the program because of all these, as you say, these barriers in the way. So
Or lost
keep
a
doing it.
spot in a program, so I mean,
Yeah.
I'm able to control all of that.
Yeah, right.
We're operating under federal rules
Of
that
course.
require us to gather a certain set of information, but if there's a way we can support the family to shorten that time, they won't miss out on that.
Job, maybe they keep that job, and also the program that they're
Sounds
selected.
great, sounds much more efficient.
And what's the scope like in terms of the number, population? Like what would we be talking about in the short run?
In the short run, gearing up in terms of where we are in timeline, June into July, we're looking at school-aged population, as well as families who have employment activities that the lack of childcare is inhibiting that opportunity.
I mean, the number we're looking at in terms of funding and sort of reconciliation is we're about 7,000 below where we were pre-COVID, and I think we will have funding in FY23 to bring us back up to that level. And so I think, that's ambitious, but I think with some of the streamlining of the system in the shorter and the long term, I hope we'll be able to hit that during the course of FY23.
And the capacity data suggests we could.
Well, I think what we don't know, and this is part of the waiting list challenge, we have very little visibility into sort of who's actually on the waiting list and if they're really eligible.
I see. Okay.
And I think one of the things we've been talking about is really getting away from a waiting list and thinking about a placement list. So if you were able to have a list of folks who are actually eligible for the programs, and then we could know that it's really infant care in Southbridge that's keeping us, and then we could recruit providers in that area. We're sort of in this opaque
Stratified.
capacity challenge. But I think if we if we start to issue, if we're able to get subsidies in the hands of families who are eligible and they're like, thank you, but I can't find an infant program to, then we're dealing with that problem instead of, but for some, I think there is capacity. So we'll know a lot more as we kind of reconcile the data on the waiting list and start to pull families who are eligible. I'm sure we're going to hit capacity barriers for families.
Yeah, the waitlist reconciliation is a big part of this. Not only are we making that phone call and reaching out and saying, are you there? Are you interested? Do you still need care? Do you still need to be on the wait list? If no, then we can change up that wait list, change that, clean up that wait list in terms of the same process. So simple upfront pre-screening, a couple of questions just to realize, what your status is. Are you most likely to be eligible? Do you still need care?
Right.
If yes, yes, keep going to the intake. If no, no, then a different escalation or just being taken off the wait list.
So we should be able to come back in September and hopefully have shown an uptick in the number of kids enrolled and have much better data about who's actually, what is that 17,000? Who wasn't eligible, who is eligible but can't find a spot, who's looking for something but is, they're not ready for it.
Yeah, I just wonder too, in the spirit of innovation, if the ones who can't find a spot, is that a moment for us to try things out in a different way?
Yeah.
Rather than just leaving it at the burden of the family? Just thinking about the systems building part of this.
Well, I think it gives us a perfect opportunity to try and recruit in areas or something different.
Yeah, for sure.
Getting data out of this approach will be very helpful because I'm not sure to say who quoted the quote, but the known unknowns are something that we'll get better handle on through this.
Yeah, because the subsidy is only one piece of it. You get the subsidy, but
That's
then you have
the
to
thing.
find the program.
That's my point. It's just, you could imagine that the lever for the EEC.
Geographics plays a big role in that.
But we don't, so I think part of what we'll get from this exercise is much greater visibility into that exact thing.
Yeah, so I guess that I would say, so do we track for, say, with this, I think it sounds absolutely awesome and much more efficient process for getting approved for a subsidy. Do we then track who actually uses the subsidy?
Absolutely, because
Because
it'd be
then if they're
available
not,
for
right,
somebody else.
then it'll tell us that there is a problem, so, yeah.
The second major thread here is the revisions of the financial assistance policy guide to facilitate family access. What this really boils down to is looking at our policies, our procedures, and really doing a deep dive, as Joy mentioned. How can we align simple definitions? I call them simple, but they're not very simple when you look under them. But can we call an asset an asset? Can we call is a car count in DTA? Does a car count is the same as at EEC? Does a car count for Mass Health? A car as a vehicle, as an asset or liability should be somewhat the same. So when one parent, as Joy mentioned, filling out one application isn't saying, oh, wait a minute, do I put the car here or here? In a Mass Health application, what have you. So how can we kind of do that? How can we identify policy, procedure, opportunities? Two things I'm going to say out of this is one, my quick kind of parlance, how I think about this is one path could be, I call stroke of the pen. Just things we can do with the right level of communication, training, deployment, but we can just do them because our legal counsel, our compliance, Joy, the commissioner, we all think it makes sense.
Existing regulatory structures.
Right, we can do it. I call it stroke of the pen. For instance, the intake application, we can just do that. It makes sense. So let's go ahead and try to see how that works. There are other parts of this output which will require much greater involvement, whether it be a budget issue, a regulatory change, a state regulatory change, and maybe needs an IT system that is not supporting what we want to do. Maybe staff need to be reoriented, or maybe new staff, depending on what we decide to do. So there are certain things that we just can't. They're more complicated. So we're kind of putting those into two different buckets. We have the group, and Joy and others are kind of leading this. Every week we go through what we have, very simply put, an idea tracker that we just kind of say, okay, this week we're going to these 5 ideas, and we cycle them through. Last I looked, there are about 40 different ideas of things that we want to look at. Some very complicated, gnarly, if you could use that term, things we really pick out. Some just, yeah, this makes sense. Why are we doing it that way? Yep, let's go. And bring it up through the right channels, bring it up to leadership, saying, yeah, that makes sense. So cycling these things through will get, I guess, to a good place. We can probably by mid-September, we'll probably a solid plan of, okay, this is what we just kind of put together because we could, and we deployed them. They're in use now. Okay, these are the other bigger pieces that require a little more coordination. Okay, any questions or comments on that? Okay. And the last piece, as the commissioner mentioned in her opening remarks, we have gotten approval from OSD to kind of do a contract extension with our CCR&R and subsidized provider contracts. A lot of that was based off of what I call our rationale for time. How we're going to use that time to do these procurements to do the things we want it to do. So we've gotten approval. We're moving that forward. We're already have an RFQ out on actually kind of getting bids due on the 23rd for qualified consultants to help us. We have a 12/18 month plan around the two contracts, meaning we're not going to do everything all at the same time because we know what we can really support, what we can't support. However, the upfront work, the visioning, the gathering of information, the gathering requirements between the two contracts will be done at the same time. So we're not doing a visioning session for providers and a visioning session for CCR&Rs, kind of collective, what do we want the world to look like visioning session, and then we can figure out which feeds into the CCR&R work, which feeds into subsidized provider work, and how do those two pieces kind of talk to each other. It's a very important aspect of how we're embarked on this work.
Yeah, I think we see the procurements as a real opportunity to use the review of the system and the policy shifts, and then that's how we push them out into the field. So the timing aligns in terms of system development too.
And one thing I'll add is, we look at these as transitional contracts, meaning we're going to be under contract with the CCR&Rs by July 1 of 2023. But that contract may take a different shape maybe 2-3 years down the road. We may add something to their plate. We may take something away from their plate, and vice versa with providers. We look at these as a multi-year contract that we'll eventually engage with, but we may kind of say we want EEC to do this, but they can't right now. They can't support it, but 2 years from now they can support it. So we need to get from the bridge to year 2 where EEC can take on this role and functionality that the commissioner and leadership want. So when we look at these, we know we're moving pretty quickly, but we're also thinking that not everything's going to be done, sealed when we have our first contract. So it'll be a bit of a transition of how we move the system.
Yeah, I mean, just recognizing similarly to the workforce system, there are immediate steps we can take right now to get additional families enrolled while we think about the longer term system redesign. And that may be a multi-year effort that gets, built into the contracts in some way. All right, questions for these two or for us overall? Hopefully we'll have a lot more updates and positive momentum in
Sounds
September.
wonderful. Thank you.
Yeah, the team has done a remarkable job in a short amount of time to identify the areas of focus.
Just from a personal perspective, once this is enacted on the ground, communicating to the families in multiple languages, as you had said, in multiple ways, I think is really, really important, as well as the hand-holding along the way.
I think it's a really good point, Joanie. I think part of what the policy guide revisions kind of implies too is that we have to make the system much more transparent for families so they can understand it and drive themselves. So.
100%. My goal, love intake application works. It makes sense. It's usable. We go through a couple of turns, then it becomes final. Then it gets translated into whatever the various languages that are most appropriate for EEC's community.
And recognizing that not everybody's going to be able to fill out a form.
Mm-hmm. Yep. And providing technical assistance, exactly.
Yeah.
Thank you.
Very much. I want to move on to the next.
Yeah, great. And we
Okay, so
that's a segue, right?
yeah, this is a nice segue to sort of, I would say, that our first formal effort around being kind of user focused within the subsidy system is that we recognized the need. I'm asking Janice DiLoretto Smith, our general counsel, to join this conversation. We recognized that there was an opportunity within our review process, which is that when someone is renewing for their child care subsidy and receives a denial, they can request a review. And our regulations and policies didn't provide consistency and stability for families in that process, or a lot of flexibility, and also barriers and denial at initial application too. So we shared the red line version with you as part of your materials. I'm going to have Janice walk through kind of our proposed changes that we hope will make this a much more family-friendly process and ensure a level of stability and care for children while families are in the review process as well.
Thank you, Commissioner and Madam Chair, Secretary Pizer, members of the board. Thank you for this opportunity. While Michael and Joy kind of focused on the beginning part of a family's engagement with the department, I'm talking about the other end of that process and that appeal. And as the commissioner said, we wanted to find some immediate steps to try to help people, help that stability, help our families who are in some tough times. So what we've proposed is basically to increase the availability of continued subsidized care during the review process. So in other words, to be a little bit more specific, and you'll see this in the red line, which is probably a little bit more red than one would expect. But what we tried to do was strike some rather redundant portions of our regulatory framework and combine them and replace them with a streamlined. Thank you.
I know technology.
I know, right? There it is, right? I can't do math either. To replace them with streamlined, consolidated language that permits continuation of childcare subsidies pending appeal when a parent is denied care at reauthorization or when care is terminated. This section will also, it outlines the parent's responsibilities to maintain that care, that they need to continue it in line with their authorization, that they need to make sure that undisputed payments are kept current, things of that nature. What we wanted to do was make sure that parents or families whose care has been terminated or denied have the ability to keep that stability, have the ability to keep that care and minimize that disruption, both to the family and also to the economic recovery that we talked about a little bit as well, making sure that our families can remain working so that knowing that their children will be in stable care. The other thing that we did was enhance notice requirements so that families are better notified of their right to appeal, and that if they do appeal, that care will be extended during that process. Making sure that families know what their options are is pretty important, and we wanted to make sure that the regulations reflected that priority. We are also establishing clear timeframes to adjudicate appeals during the request for review and informal hearing process. We want to make sure that these are heard effectively and efficiently. So that people can get a decision and get it in the fastest way possible. Another thing that we did was recognizing that folks whose care is denied at the initial authorization, and by that I mean they don't have a subsidy to continue, that we're prioritizing those so that they get their decisions faster. In a quicker format. So again, it's trying to minimize disruption. It's trying to mitigate the challenges that sometimes families face when trying to maintain stability in care. And one of the last things that we did, and again, this is focusing on that human-centered approach that you've heard about not only in May's meeting, but also today, and I think you're going to continue to hear over the course of the next several meetings and months, is we decided to change our regulations to allow for our review hearings to take place via a virtual platform. Rather than have a family have to drive into Milk Street and try to find parking and disrupt their day, we're going to allow them, if they elect to have their hearings done over virtual platforms. And we've actually already put that in practice. That's something that we're doing now, and in fact, a hearing was conducted here in the Taunton office earlier today because the family elected to have that hearing held here as opposed to a virtual platform, and our hearing officer came here to conduct it. So these are, and again, we know there's a lot more work to do. We know this is the beginning of the conversation, but we are trying to identify immediate steps that could be taken to make things simpler, easier, and more streamlined for our families. And these are the proposals that we're putting in front of you today. And again, what we're asking for, and I know there's the vote language is up on the screen for you, Madam Chair, but we're asking for you to give us permission to get this draft language out for public comment so that in September we can come back to the board with final language for promulgation. So this is the first step in the, I think Michael talked about baking a cake and the steps to making a cake. I call the regulations a sausage making machine. This is the first step in that process. And we hope that you will approve them. I'm also happy to answer any questions that you might have.
Questions for Janice? Thank you.
Sounds good to me.
Great. Jamela, any questions?
No question.
Thank you. All right, let me make the motion. I make the motion, move that the Board of Early Education and Care hereby approves the department's proposed amendments to the regulations governing early education and care financial assistance appeals, and the board also authorizes the acting commissioner of early education and care to solicit public comment in accordance with General Law, Chapter 30A, on the proposed amendments to these regulations, subject to approval of the final regulations by the board. Can I have a second, please?
Second.
Thank you, Carolyn. Carolyn Kane,
Yes.
Paul Belcito,
Yes.
Secretary Pizer,
Yes.
Morris Siegel, Joanie Block, Jamela Lee.
Yes.
Thank you. Approved. Thank you.
So much, appreciate it.
Can I just ask, when it goes out for public comment, and I'm sure you will do this, but try to gather the voices of families multiple ways. Whether it's through writing, through groups, conversation, liaisons, whatever. I just think it will be important to reach down and really touch the family. So thank you for doing this, families.
Thank you. And I imagine before we present the final language to the board at the September meeting, that we will also include a summary of what that public comment looks like, so that the board is aware of what we're hearing back from folks on these proposed changes.
Thank you.
Thanks.
Great. Thanks so much.
Thank you, Janice. Thanks.
Okay, well, at this time, thank you all. The board will now meet in executive session to discuss strategy related to pending litigation, the Echeverria matter. The board has determined that discussing this matter in open session will have a detrimental effect on the litigation position of this body. The board, as a matter of logistics, will not reconvene in an open meeting following the conclusion of this executive session, and instead we will adjourn directly from the executive session. So I will now call the roll of the board to convene the executive session. Carolyn Kane?
You're making a motion to go into executive session? Yes.
Yes. Second for that motion, Carolyn. See, I told you, she's very helpful to me.
Yes.
Carolyn Kane, thank you. Paul Belcito?
Yes.
Commissioner Kershaw? Assumed.
Yeah.
Secretary Pizer?
Yes.
Morris Siegel? Joanie Block? Jamela Lee?
Yes.
At this point, the open meeting is concluded, and I excuse all members of the public. Meeting adjourned in that regard. Thank you all.
Thank you, Andrew.